Public CEO Report is a podcast that provides insights about the public sector and public policy for the benefit of decision makers and leaders powering our communities. I'm your host, Ryder Todd Smith, and today we're joined by Jesse Chang, founder of My Mask Movement. My Mask Movement creates custom manufactured masks that are helpful for frontline workers addressing the pandemic and reducing exposure risk to the novel coronavirus. Jesse, thanks for joining us today. It's great to have you here.
Thanks, Ryder. It's really good to be on.
So what is My Mask Movement?
My Mask Movement is a social enterprise that I started back on March 9, 2020, when I got a call from my little brother, who's actually a frontline ICU doctor. And both him and his wife, they're both frontline doctors, and they're also new parents. When I was speaking to him, I heard about this really extreme shortage that they were facing with N95 masks and how he had to spray down his mask with Lysol. And when I heard about this, it just shocked me. I wanted to do something about it. And even though I've never worked on medical devices before, nor have anyone on my team, we do have a lot of experience in 3D. I've spent over the past decade working on 3D. And so I went to that skill set and went to that network and created a new technology that today enables you to make completely 100% bespoke face masks. One of the things that's very important to note about a respirator, which is actual PPE, like the N95 versus something like a cloth mask, is that it's airtight. In order to really get a good airtight fit, you need to have it so that you have the right size. However, with a lot of these masks today, not only is it hard to get access to an N95, when you do find an N95, good luck finding one in your size. So today, many frontline healthcare workers not only have to go in with questionable supply of PPE, if they do get an N95 mask, they haven't necessarily been fitted for it. And on top of that, it's plagued with supply chain problems, including a lot of counterfeit N95 masks. And so that's why we wanted to create a solution where we can make these masks here in America using digital manufacturing. And not only can we make masks that are available here with guaranteed supply, we can do so at very high scale, and we can do so while making the masks even better than what you would get using today's current technology.
So you just said a ton of stuff there, and I want to unpack a lot of it because there's some important things that you've said that were frankly things I hadn't fully considered when you and I first started talking, and I had a conversation with you about My Mask Movement and the mission behind it. So first thing to just discuss, I mean, there's a lot of talk about masks around the world, certainly here in America. There's debate about masks. I was just reading a headline today where the CDC director was stating that the mask was the most important utility, more importance than, frankly, a vaccine is what he supposedly said when it came to combating the pandemic. We, as a average Joe, I don't have an N95 mask. I have various masks we wear that are cloth masks around our face that we use for Tripepi Smith and going to the grocery store. My understanding is those masks are intended to prevent what I'm exhaling from getting too far, dispersing too far and wide, and becoming a problem if I happen to be asymptomatic. Of course, if you're sick, you're supposed to stay home. The mask that you held up there, which I'll ask you to kind of give us a tour on in a moment, is more designed around a different concept in that instead of worrying about preventing the exhalation of sickness, although that would probably, I assume, achieve that, it is also designed to prevent the actual inhaling of coronavirus that would result in one getting sick because it has such a tight seal that can face. Is that an accurate statement?
So here's the thing about surgical masks and cloth masks. What they don't do is provide airtight seal. What they are considered is instead source control, which is, as you said, only intended to prevent you from infecting others and don't necessarily give you protection against getting infected from airborne particles yourself, like coronavirus. However, one of the most essential elements to creating effective protection is that airtight seal. Now, people like you, Ryder, or anyone listening to this podcast that isn't a frontline healthcare worker are going to have difficulty getting access to N95 masks because currently they're being rationed and they're being supplied by state and federal governments, which leaves municipalities in a pretty tough spot because municipalities actually employ a lot of essential workers. Think about the garbage collectors, think about law enforcement, think about firefighters, think about even social workers. People that are really important to the central functioning of America and the backbone of America. And by the way, a predominantly diverse an increasingly diverse workforce that struggles to get a mask that not only prevents them from infecting others, but also gives them adequate protection. I think we can do better than that. I think we owe them better than that. And our real mission here is to conquer fear with love by equipping these essential workers with the PPE that they need so that they can go forth in confidence into society to do the work that they need to get done. And so people like yourself and all the other people that have been, quote, non-prioritized are able to get masks.
So to make sure we clarify that point, then by having that complete seal and then routing the air intake through this mask filter on the front, the intent is that it would reduce your risk of picking up the coronavirus when you are out and about inhaling. Is that an accurate statement?
Yes, that's right. So here's what's going on. When you have a surgical mask on, you'll notice that sometimes when you breathe out, for example, one of these things, if you put it on and you blow out, you can see it, you can feel it rushing past the side. And when you breathe out as well, you can feel your glasses fog up.
Right.
All of these are exposure points that can let airborne particles infiltrate and infect you.
So
now with the airtight fit, however, the air goes through the filter. And because the air is going through the filter, well, you have an extra level of protection. You know, this is a matter of protected, not protected. Source control versus actual PPE.
All right, so then why don't you give our audience just a quick tour, like turn around, show me the parts of that mask and what it looks like and how it works.
Be happy to. So before I go into all of this, right, first of all, to get one of our masks, what you have to do is you download our app from the App Store. You go to the App Store, you download My Mask Movement, and then once you scan your face, you hit Print My Mask. In 9 days, you will get one of our masks in the mail sent straight to you. As so.
So just so we're clear about that, the app that you're talking about is designed to use the depth of field capabilities within like an iPhone in order to actually 3D map your face to create the perfect fit for that mask so it fits exactly over your face. And I realize you probably didn't just hear what I just said. So
no,
let me
I did.
I'll say that
I did
again.
Hear that.
Yeah, that's okay. You were doing what you need to do. So just so I could clarify for the audience, the intent here with the app is that it will use the camera technologies on modern iPhones to do a three-dimensional map of your face structure. And that data will get fed into a custom printing device that will ultimately result in creating a custom fit mask that will perfectly fit around the mouth.
Yes, that's right. So simply stated, you scan your face using your iPhone. Once you scan your face, we take care of the rest. We create a model that completely fits you and only you, and then we send it to our distributed network of additive manufacturers, all based here in America. And then in 9 days or less, just like getting an Amazon package, it comes straight to your door.
So now, can you talk a little bit, take a second there, explain a little bit further about the US-based manufacturing. And I only raised this point because, for example, I was just reading a story that broke yesterday about Customs and Border Patrol stopped an inbound shipment of about 500,000 masks coming out of China that are apparently counterfeit or aren't really N95 masks. And so they were bound for New Jersey, which theoretically would then distributed them to a bunch of folks without them actually being true N95 masks, and frankly could have as a result, put more people at risk because they would have assumed they were safe with them. So could you just explain about the onshoring of that manufacturing process, generally how that works without giving away your secret sauce, and discuss why that's important?
Yeah. Well, first of all, the counterfeit mask was also one of my major concerns. It turns out that not only are we getting masks that aren't actually effective, they're in fact dangerous. Many of these masks come laden with asbestos. That's right, asbestos, the same stuff that gives you very scary forms of cancer, right? And so not only are you getting a false sense of security, you're actually putting yourself at a higher risk level. And so in this way, I think there's a real opportunity to create a domestic supply chain where there's traceability and there's accountability, none of which you get when you have a very extensive foreign supply chain. So this is why I think it's really important that we make the masks in America, and we make the masks in Canada for Canadians, and we also make masks in Africa for Africans. We want to make it so that not only are countries sovereign in terms of their political power, but also in terms of their right to breathe. And so that's one of the very important missions of our enterprise at My Mask Movement. Now, to answer your question around, okay, what's going on with this decentralized network here in America? Well, simply stated, we have several of these high-grade industrial scale additive manufacturing machines. They're able to produce these at consistently high qualities and also able to do so at scale. In 1 month, we're able to make the equivalent of 3 million single-use N95s. And so to put that into perspective, over there, if you're the shipment that you were talking about, that was 500,000 counterfeit masks.
Okay, so Jesse, just talk to me a little bit about the U.S.-based manufacturing process and why that is important, and kind of what the quality of those facilities are that are manufacturing the masks here in the USA.
Yeah, so here's what's really important about manufacturing in the USA. For something as important as PPE, where it's a matter of life and death, you don't want to go in wondering, is this mask I'm wearing a real mask? Is this mask perhaps laden with asbestos? That is fundamentally one of the problems that I think is ripe today with the PPE market, is the sense of insecurity in supply, and also lack of confidence in the supply chain. You don't know where that mask came from. If China's banning all the exports of their N95 masks, and they manufacture over 70% of the world's N95 masks, and you're getting N95 masks manufactured in China here in America, one has to wonder, where did that mask come from? How did that mask get to America? Is it the same channels the Adidas shoes come from? Frankly, that's not a risk I'm willing to take myself. And for me, and for people like my little brother, I want to make sure that they can get a mask that they know will work, that they can have confidence in. And so that's why we created this solution here, and that's why it was very important to us that we have a completely indigenous supply chain. Every single component on this mask is manufactured here in America, in states like Colorado, California, Tennessee, and Virginia. So we're making masks in America for Americans, and in that way, restoring American sovereignty and restoring the ability of America to protect its essential workers, including municipal governments.
Okay. Why don't you go ahead and you can take your mask off too if you want, so that you can be more comfortable through the rest of this interview too.
It's real comfortable, in fact.
Oh, that's true. I guess I shouldn't imply it's not uncomfortable otherwise.
But
so
here's the thing, I think one of the things people need to understand is that in general, when you have something that's actually airtight, like an N95 mask or like our mask, it is a matter of can you achieve airtight fit while ensuring the comfort of your wearers? Because if it's not comfortable, then people aren't going to wear it. You know, you'll see doctors actually go into operating rooms and then they'll quote unquote break the seal by like flinching their cheeks and whatnot so that they can breathe a little bit better. And so for us, because we are able to 3D scan your face and because we have a very accurate 3D model of your face, we can make the mask completely evenly distributed across the different points of your skin versus concentrating pressure on just a few points, which creates those very scary facial ulcers that you see on pictures of doctors that wear N95 masks for 8-hour shifts.
Right. That makes sense. So you're effectively distributing the seal points across a broader swath of the face to alleviate those pressure points on the face.
Basic physics.
Yeah, basic physics. I like physics. Physics is truth. So could you had made an earlier comment, or when we were discussing this, about that you essentially have the capacity to manufacture the equivalent of, I think it was 3 million N95 masks with the capacity you have to print and manufacture these in the U.S. Partly, I assume that number is rooted in the fact that the mask you're wearing is designed to be reusable, which is another key point. First of all, is the idea that the filter can come out of the front of the mask and replace it so that you just swap out the filter every now and then, but the mask, obviously, you just keep using it over and over again?
Yes, that's right, Ryder. So specifically, we've designed this mask together with the input of doctors here at Stanford, including my co-founder, Dr. Stanley Liu, who actually is a ENT doctor and facial reconstruction expert. So one of the things that we learned during this customer discovery process and working through Operation Centurion, which was getting our masks to 100 frontline doctors through Stanley's network, was that it's really important that you can sterilize these masks. And so for us, what we designed this mask to be able to be sterilized with are very common techniques available at most hospitals and easily accessible by your everyday man. So specifically at a hospital, you can use single chamber sterilization techniques, and you can clean it up to temperatures of 80 degrees Celsius. As a consumer at home, you can throw it in your dishwasher. That's right, in your dishwasher, so long as it doesn't exceed a temperature of 80 degrees Celsius, and you can wear it for up to a year. And then swap out the filters every 30 days. You remove the front part of the mask, you put in a new filter cassette, and you keep going every 30 days. And so what we provide here is not just the mask, we also provide the filters. We've secured the filter supply chain with minimum supply agreements. As everything, again, is manufactured here in North America. And we, in this way, not only are we offering PPE, but we're offering a service, which I think, as we are learning here today during this pandemic, is important when it comes to your life-saving equipment. It's like a fire department. You don't want to have to create a fire department when there's a wildfire. You need a fire department there, even during times of peace and stability. Likewise, you don't want PPE supply chains to have to be spun up during an emergency. You want that ability domestically available on demand. And with our solution, the service that we offer, the guarantees that we're able to provide municipal governments, that's exactly what we do. We provide PPE as a service.
That makes total sense in terms of not wanting to have to spin up a supply chain while you are in the middle of battling a fire, right? Like you want that on the ready, at the ready to serve the needs of the organization. So Jesse, I want to bring some clarity to our audience too about the My Mask movement mask and how it compares to an N95. So we've talked about the fact that it's a custom fit, that it doesn't allow air to escape around the sides, whereas the N95 is not custom fit, so it could very well allow air to make it inside. then also there's not a question, but there's the difference between, the filter unit that you have on the front of your mask versus a standard N95 mask, which is obviously just kind of all around it. Could you just make a couple comments for our audience to clarify what the relative capabilities or safety is of an N95 mask versus a My Mask Movement mask, and how those compare?
Yeah, sure. So first of all, today we know that it meets the ASTM level 3 spec as a procedure mask. We've done very rigorous testing on it to show its bacterial filtration efficiency, particulate filtration efficiency, pressure differential, and a myriad of other tests, including flammability, biocompatibility, cytotoxicity, all are up to spec. Also fluid resistance, right? So we've done all those testing, and now we are going through the FDA approval process to get this authorized as a class 2 medical device. But this is still an ongoing process, and we hope to have that by the end of this year. I'll say this though, one of the things that's most important about N95 mask and N95 level protection is its ability to provide airtight fit, just like you said. No airtight fit means exposure risk. Airtight fit means lower risk. It's all a matter of lowering the different levels of risk. And we encourage any worker out there to wear as many layers of protection as they can, especially if they're coming in contact with coronavirus. Having an airtight fit product versus not having an airtight fit product is going to really matter if you're going to be in exposure to things like coronavirus or any other airborne particles or any other aerosol generating procedure that you may go through. And so for us, that's what we can say right now where we are at. And that's the testing that we've done. So, yeah.
So Jesse, I want to pick up on one of the things that you brought up there, and when you were discussing kind of the importation of N95 masks and the risks associated with that, you had effectively kind of implied that the masks, N95 masks making it into America today, are making it here despite the Chinese government having an export restriction. I know I've heard 3M indicate that they are bringing in lots of masks, and including masks they're manufacturing in China into America. I also know that early on in the pandemic, there was restrictions that China had placed on the exportation of N95 masks because they were scrambling to control supplies and make sure they had sufficient masks for their own citizens in their countries, which frankly speaks to your whole point about independent nationalism of each nation being able to manufacture its own PPE. But could you just clarify a little bit when you make the statement about the sourcing of masks coming into America, N95 particularly, coming out of China, what you see as the restrictions there, either early days versus where we're at today in the month of September 2020?
Yeah, sure. First of all, there's just so many people popping up right now that are saying they're making N95 masks. Right, and it's really hard for major corporations out there to really protect their brands and their trademarks, especially as it comes to N95 masks, right? And so I think this is a very big problem that's faced by many countries, not just America, that fundamentally is inherent in a foreign supply chain where you have a lack of traceability. Now, in terms of what is the current state of export restrictions, import restrictions, is so dynamic. I think that's one of the things that is certain during this time of VUCA is uncertainty. Uncertainty is the only certainty. Things are in a constant flux. Today, you may be able to import some N95 masks. Perhaps they've been able to get past export controls in China. Perhaps they've been able to get past Customs and Borders here in America. Perhaps they haven't been intercepted once they get to your municipality. But by that time, there's been so many hands that have touched this. Do you even know where it's come from? Do you even know where it was made? Do you even know it's the real deal? I think these are open questions, and I think one of the problems today, and one of the problems that we're really trying to address, is the lack of confidence in the supply chain. And that's why we really want to bring it back to America. Because if it's here in America, there's traceability and there's accountability, right? Think about it. Given the current restraints and resources that we have here in America, given the fact that there are so many people in America and also in countries like China that are trying to pump the market full of perhaps less thought out N95 masks, who's going to go regulate that? Who's going to go inspect that? And so there's a real problem today. And that's one of the problems that we really want to do a good job with solving, is to solve the lack of confidence in the supply chain.
So I want to bring us towards some conclusion here as we talk about this mask. There's first thing, people are always going to wonder what the cost is. So could you talk a little bit about that cost structure generally for the mask, so that professionals out there, city managers, fire chiefs, people in charge of the emergency response for municipalities have some sense of this cost, and obviously take the time to break it down in comparison to traditional disposable N95 masks.
$1 a day, right? $1 a day. Here's the problem with buying N95 masks today. You buy them in boxes of 10 and 20, and you stockpile them, right? Now, there's many things that's problematic with that approach. First of which is, when are you going to be able to buy your next box? We solved that. With our service, you pay $1 a day. No worrying about will your filter come, no worrying about if you'll be able to access this during a pandemic situation, including right now. You pay us $1 a day, and you don't have to worry about procuring PPE for your essential worker for the rest of the year. And put that into perspective, right? For someone that's buying and using a single-use N95, if you provide your essential worker with just one N95 mask a day, that's at today's current prices $4 to $7 a day, right? So that's $4 to $7 a day just for one N95 mask. With us, it's $1 a day, no bull crud, just simple $1 a day. Get your mask, get your PPE. Simple as that.
Okay. Well, theoretically, it's $1 a day for a mask that's actually more effective than the N95 because it's custom fit, correct? I mean, that's the idea behind this whole point, this whole effort.
We've done very robust testing of our masks as well, too. We know that it meets ASTM level 3 spec. And currently, we're going through the FDA approvals process. And yeah, we're going for full-blown FDA approval and clearance of our mask. We're not just going for this emergency use authorization, because we know that we have a product that can outperform today's gold standard, which is the N95 mask. We want to back that up with rigorous testing and also the highest possible scrutiny.
Okay. Could you talk to me a little bit about where these masks are currently being used right now? Because obviously you're in early stages. I don't know how many units you've generally put into the field or where they're being used. So cities, much like many organizations and strata of our economy, like to know that they aren't the first to necessarily do something. They want to hear what others are doing or kind of what the market proof is on that. So could you talk a little bit about who's using My Mask movement masks right now?
Yeah, so far, we've deployed this to over 100 doctors here in America. Again, through Operation Centurion, we call them our Centurions, and these are our early adopters. These are people on the front lines through our networks, specifically through my co-founder, Dr. Stanley Liu, and his network. And now that we've gotten ourselves to ASTM level 3 spec, we are now beginning to roll this out and starting to sell to governments as well as to healthcare facilities.
Okay.
So to put it into perspective, this is how it works. If you are a municipal government and you want to provide masks to, say, your law enforcement or to your social workers, here's what you would do. You would reach out to us. Yeah, I'd get on the phone with you. I'd send over a team, including a kiosk. We'd set it up in a break room. We'd set it up at a front desk. You have each of your workers come through. We get their faces scanned. And as soon as we finish their scan in 9 days, you get the mask sent straight to the door of that facility. You hand them out, and we send the filters again every 30 days to that same facility. This is ready to go now.
Okay. And so you mentioned this. How do people get a hold of you? How do they find the information?
Jesse at mymaskmovement.org. That's JESSE at mymaskmovement.org. Or come to our website, check it out, learn more. Add me on LinkedIn, follow me on Instagram, whatever you'd like.
And I assume the website is mymaskmovement.org as well?
Good guess.
Okay, just want to make sure for the audience's sake. All right, well, that's that. I think that brings us to the conclusion. Is there anything else you want to note, Jesse?
Yes. Here's the thing that I don't think a lot of people are aware of that I think is especially important for people that are policymakers and decision makers that are in a position to possibly affect change in society. The current generation of N95 masks are based on primarily Caucasian males ages 29 to 45. The sample size that they use to make the 10 NIOSH head forms are nearly 2 decades old. Here in America, we know that we are a country founded and excelling based on the diversity of our people. Every 10 years, we know that our population changes, which is why we do a census every 10 years. Yet, when it comes to N95 masks and PPE, 2 decades, almost 2 decades old. This is something where not only is it outdated, it's straight dangerous, and it most disproportionately affects women, persons of color, children, and the elderly. Now, one of the reasons why I left a very lucrative job to start this and go at this full time, together with a team of other people from here in Silicon Valley, is because we see a real injustice in society today. We see a problem that we want to fix, and we are not necessarily just driven by pure profit motive, but we're driven by a desire to affect positive change for society. And it's going to take the help and involvement of people like your listeners, which is why I'm here today, because you, the audience, are in a position to bring equity to PPE. You are in a position to make sure that those who are most vulnerable and most essential to your municipality's survival can get the protection that they not only need, but they deserve. And that's what we're trying to do here at mymaskmovement.org. We know we're a startup, but we hope that you'll join us on our David versus Goliath mission and really advance PPE in a direction that decouples our dependency on foreign supply chains, decentralizes power from centralized power, and democratizes power and empowers the minorities, and fundamentally addresses the tyranny of the majority, as our founding father said. Or more specifically today, the tyranny of mass production. Thank you.
All right, Jesse. Well, that was quite a don't tread on me speech, but I get the point you're making. And obviously the power of customizing masks and being able to fit them to the unique face of every individual who's out there in the world is a very powerful thing to do for the sake of safety and joining our battle to address the coronavirus pandemic. And that's today's report. My thanks to Jesse for joining us. For the whole Public CEO team and myself, Ryder Todd Smith, thank you for your time.
We hope you learned something new and inspiring that'll help you in your public service. Remember, PublicCEO has a daily newsletter that is free to those who sign up at PublicCEO.com. If you have feedback, questions, or guest suggestions for PublicCEO Report, please email alex@PublicCEO.com.